I know we live here in Colorado and it's a beautiful day. And today I want to talk to you about joints, but not that kind of joints. Today I want to talk about one of my favorite joints. I mean, there's not that many that are my favorite, but the shoulder. What a great joint. So, my name is Dr. Rachel Langley. I work here at Pine Ridge Family Medicine in Colorado Springs. It's a direct primary care practice and it's awesome. I love working here. But a lot of people come in with shoulder injuries. Now, the shoulder is such a cool joint. I mean, you can think about other joints in your body like the elbow and fingers. Pretty much they just bend, just flex and extend, flex and extend. You get a little bit of other movement going on there too, but mostly just flexing and extending. The shoulder though, I mean, talk about a cool range of motion. Look at all the things it can do. Way more than just flex and extend. And it can rotate in and out, go in and out that way. Oh, so many cool things. I mean, it's a ball and socket joint, which means that there's a bone that kind of fits into a cup, which is the socket, and that's how it's able to achieve all that movement. Your hip is a similar joint, but it's got what's called a big labrum. The upper part of the cup is really long, really cuppy. So it holds it in place better, and you're much less likely to dislocate your hip, much less likely to have quite as many hip problems as we do shoulder, because the shoulder is a much flatter socket. Instead of being like a cup, it's really more like this with just a little bit of cupping to it. So that means it's prone to a whole lot more problems, but it also allows us to do so many cool movements. So say you're having some shoulder pain. One of the most common causes of shoulder pain that I see is rotator cuff problems. What's the rotator cuff? The rotator cuff is made of 4 muscles that go from your back or from your arm to the other side. So they cross over and allow this great range of motion. So those hold the socket and hold this bone in the humerus into place in a way to kind of make up for the lack of cupping that's present on the other side in the socket. So you've got muscles that are trying to make up for the fact that you lose a lot of stability by having such a flat thing for your humeral head to be sitting in. So that's why the rotator cuff muscles are so important, is they allow your arm to stay in place even while you're doing these crazy movements. But that means they're really prone to be injured. They can be strained, they can be ripped just a little bit, or they could be torn right in half. I trust a physical exam a lot because I don't have an MRI machine handy. So if I come and see you for some shoulder pain, I'm going to have you go through a lot of range of motions to see if you can do those motions in the first place and if you have pain with them. Most people with a total rotator cuff tear won't be able to do certain motions, won't be able to make it higher than this or something like that with their shoulder. So that's a clue to me that something more serious might be going on. But for the vast majority of patients that I see with shoulder pain, they really just need to rest that shoulder to a certain extent to allow the tendons of the rotator cuff to heal over. It's most commonly a tendinitis. But the shoulder is such a tricky joint, because if you completely let it rest, like in a sling for days at a time, you're going to get what's called frozen shoulder, where the joint just locks up. So it's a tough balance between keeping mobile and letting those tendons rest. But after you've gotten some decent rest for your shoulder, it's starting to feel better, you're ready to rehab it. I wanted to go over with you today the 4 cardinal movements that I recommend and that most physical therapist doctors recommend for the basics of what to do for your shoulder if it's starting to act up. So my favorite exercise tool to allow this to happen is an elastic band, a TheraBand, something like this. This is attached to my cabinet there. I recommend you attach it to something more sturdy than a cabinet door, probably a doorknob that you can close, but for the way my office works, this is what's going to have to work for now. So say my right shoulder is the one that's hurt. One of the basic movements is to work on external rotation. So that means to have the elastic band going across your stomach and to keep your elbow real close and tight to your side there and rotate your shoulder so that the elastic band goes in towards your stomach and out again. So you're using the external rotation of your shoulder. You're making that movement. So that's one of the best movements for rehabbing your shoulder. Another one is to switch it up and to go the other way. So to go away, let's see, can you kind of see that? You still have your arm in like this. You grab the TheraBand and move the band the other way. So before you were pulling outward was the effort. And now you're rotating around, so you're pulling across your body, and that's the difficult part there. I'll kind of rotate so you can see that. So both motions, internal rotation and external rotation, are important for your rotator cuff. A lot of people have a tough time moving their arm up at all with abduction. So a good one for slowly getting that motion back is to be able to slowly walk your hand up a wall or up a door frame. So it's nice to be able to hold your hand with just a little bit of friction against the wall to kind of let the muscles relax, and then inch up a little bit more, a little bit more. After you're able to get some good motion, maybe not complete motion, but improved, then grab your TheraBand and untie it from your doorknob, and then stand on one end. Ta-da! And then work on moving your arm up like this against the resistance of the band. There are different bands out there with different strengths. They get tougher and tougher to pull as you go along to give an approximate amount of weight. But it's a nice way to be able to, if you were to try to do these kinds of exercises with regular weights, you'd have to lay on the floor and make sure you get the angle just right. I like TheraBands because they allow you to do that without lying on the floor, which a lot of my patients don't feel comfortable doing. So, love the TheraBand, love it for rehabbing shoulder injuries, recommended all the time. Go through these exercises with lots of patients. So hopefully I can use this video to remind patients how to do them, because it's easy to forget. And if anyone out there struggling with shoulder pain, these are good exercises to start with. As usual, if you have any questions or concerns, go and talk to your doctor about them. And please, if you're in the Colorado Springs area, please come and see me here at Pine Ridge Family Medicine. Please subscribe to our videos. Right there. I'll put the button there, and this video might be of interest to you as well.